What is the treatment for periodontal disease? So, to begin with, the periodontal disease, some of you may or may not know this. Periodontal disease means gum disease. The gum disease happens to the bone as well as the gums around the teeth. So, in other words, although it is called gum disease, it not only destroys the gum tissue around the tooth, but it also destroys the bone that is underlying on the gum tissue. So you will get gum disease and you will get disease to the gum. When you get gum disease, you will get some disease to the gum as well as the bone. And the eventual problem with the gum disease is if you leave it untreated, and you will end up losing the tooth. So how do we treat the gum disease? So the way you treat the gum disease, if you have, depending on the type or the severity of the gum disease, it could be as simple as, in layman term, we call it as, it could be as simple as gingivitis, which may be cured or which may be treated very easily just with the regular cleaning. But in periodontal disease, we have early, moderate, and severe. If you have early periodontal disease, it can be very simply cured with what we call it as a deep cleaning. When you have severe or when you have a moderate to severe gum disease, sometimes it may not be treatable just with doing some deep cleaning. In that case, you may need what we call it as a gum surgical procedure or a laser gum surgical procedure that need to be done. When you have very advanced disease, then that cannot be treated either with the deep cleaning or with even the laser gum surgery or a conventional gum surgery. You may end up having to lose some teeth, or you will end up needing to lose some teeth along with need for some kind of a bone grafting. So to answer your question, what is the treatment for periodontal disease? Depending on the type of disease or the severity of the disease, the periodontal disease or the gum disease you may have, it may range anywhere between doing a regular cleaning up to losing the tooth and having a bone graft.